Hello everyone, I'm Dr. Naidila Jain, consultant psychiatrist and your host today at Dr. Cerebral Mind. Today I'll be talking about ADHD in children. Let's begin with understanding that your child being hyperactive is not your fault and neither is it your child's fault. Also today we'll bust the myths regarding ADHD in children, talk about the brain science and parent strategies which has the best evidence, and also lastly we'll touch upon the treatment line of ADHD in children. The first myth is that ADHD is just bad parenting. Honestly talking, ADHD is a neurodevelopmental disorder. How a child, when they cannot see properly, they cannot copy or read from the board in class, and they need a specs as a support. It's the same way. ADHD is a neurodevelopmental disorder, and all that they need is support. And here, nobody is to be blamed. The next myth is kids outgrow from ADHD. No, ADHD symptomatically starts manifesting itself differently. For example, a child is very hyperactive whenever they attend any social event, they run around, they play around, they go and hit other children or maybe fight with other children. But as they grow up, they understand that there are a lot of other social norms that have been put. So instead of showing their hyperactivity on the outside, it is redirected inwardly, making them become more restless, fidget more often. So it is basically that they don't outgrow from it, but they start to show it or manifest it in a much more different manner, and they start redirecting it inwardly, and which causes even symptoms like anxiety quite often as they start growing up. The next myth is that ADHD children cannot focus at all. No, that's absolutely not right, because if they are interested, they can sit for hours together, do the same thing for hours together. For example, if they like playing video games, you've seen that they can sit for even 10 hours straight. But that's not the same thing when it comes to a boring task. They get bored very easily, which makes them find it difficult to pay attention to tasks that is boring, because their dopamine levels are quite lower than the others. The next myth is that medication alone can solve everything. Let's take example of diabetes mellitus. A person with diabetes mellitus needs to take medication and also needs to make lifestyle changes like diet modification, increase exercise. In the same way, even children with ADHD, other than medication, they also require some modifications in their day-to-day activities, which include attention-enhancing activities and many more. The ADHD brain is wired differently. The prefrontal cortex is actually responsible for planning, executive function, and impulse control, whereas the basal ganglia is responsible for motivation and various other activities. But the connection between these, the prefrontal cortex and the basal ganglia, which we commonly call as the CSTC loop, is impaired. Then our favorite neurotransmitters, the dopamine and the norepinephrine, are not able to filter signals normally. So because of that, there is difficulty in focused attention and also difficulty in resisting an impulse. The best result was seen in ADHD children when parent training was involved. So the parent training firstly includes managing the hyperactivity of the child. So a child has a lot of energy. So redirecting this or repurposing the energy of this child into a more productive manner by including their hobbies, maybe dancing. So if your child likes dancing, you can add that in their regular routine. Also send them to playing classes or sports or athletics, which channelizes this energy into a more productive manner. A parent can start with giving more short, clear instructions. For example, tell them sit on the chair instead of telling them behave properly. It makes a lot of difference. Then teach pause habits, like for example, stop, breathe, think, and then act. It might be slightly difficult initially, but later it starts becoming a habit. Nextly, sometimes it's okay to reward immediately for a positive action and also keep regular reminders. Managing the inattention by giving regular short breaks So if they are sitting for studies, keep breaks in between. Even if it is frequent, it is okay. The next is a general support. Firstly, remember consistent parenting, what the mother tells and what the father tells. They both have to be consistent with what they are telling the child. Nextly, stay calm because always children learn to mirror the parent. Firstly, the diagnosis can be made only by a psychiatrist or a psychologist by taking detailed history, then applying various scales and tools for assessment. Next, the treatment line includes a multimodal approach. Firstly, starting with the medications, it can be stimulants or non stimulants based on the symptoms of the child. Nextly, behavioral management, which becomes a very important part, which also includes parent training in this. Then school training. So this might include the school or might include the individual child where individual accommodations are tailor made to this child. Nextly, the lifestyle modification, which includes healthy diet and exercise regularly and mainly reducing screen time. Let's all remember ADHD is not a life sentence. ADHD has its own pros and cons. So let's focus a lot on the pros, where a child with lot of hyperactivity, lot of energy can do so many things. Let's plan on just channelizing it well. And also impulsivity. So impulsivity is somewhere a step towards creativity. So let's encourage the child to be creative. Right support and right training might make the child do wonders. You have few thoughts in your mind, but your ADHD child has thousands of them, and she or he still tries to eliminate them and tries to focus on one at a time. If you found this video helpful, share it to other parents and teachers or whoever else might find it helpful. And don't forget to subscribe Dr. Cerebral Mind and follow for more mental health insights.